going on here? You've got doctors here, people who have taken an oath, people who are supposed to be protecting people, and they're turning people away. Doesn't this go against everything that they stand for?
Well, I think there are two key issues here, and it's more to do with administrative issues rather than a question of ethos, as it were. So the first is that receptionists are often under the impression that they need paperwork or ID from patients before they register them, and that's completely understandable. There are many good practical reasons for having patients' addresses and for checking their IDs when you register them. For example, if you are seeing a hospital consultant, then the hospital consultant will use the address registered at your GP to correspond with you. There are also reasons to do with patient confidentiality, because patients understandably would not want their records to be sent to the wrong address. So perfectly good practical reasons for receptionists trying to get paperwork and ID from patients. I think there has been a lack of clarity about the rules, and it's good that NHS England have made it absolutely clear that paperwork is not required. It's not just useful for asylum seekers, it's also useful for homeless people. But this is really an administrative issue. It's an issue of receptionists often not knowing what the rules are, and of really trying their best to get as much information as possible to ensure that records are safe and that hospitals and indeed all healthcare professionals can communicate with patients effectively. It's very important to remember that GP practices are the organisational hub of all patient data and records. So wherever you are seen, regardless of whether it's a walk-in centre or hospital or wherever, the records from that encounter go back to the general practice. So important to have good, robust methods of ensuring that correct data is saved on systems.
But would just merely speaking to the receptionist solve the problem? Because a lot of people who go to see a doctor may not want to give those details. They may not have that information. They may come from a country where they're just so used to not wanting to give out such information about themselves. There's a lot of cultural differences that could affect this as well.
Absolutely. We know well that there are things like language barriers. A lot of asylum seekers have come through war zones, have massive psychological issues, and it's very important that we do our best to reduce those barriers and enable them to access healthcare. It's important both from an altruistic point of view to ensure that they get the best healthcare possible, but it's also important with respect to the rest of the public. There are diseases like HIV and TB which are contagious, which can spread to the wider population, as it were, as well. So very good reasons for clarifying this, and I think the Department of Health has done the right thing by making it absolutely clear that asylum seekers do not need ID and paperwork to register with GPs. And there are collateral benefits of this for other people who are not asylum seekers, who may not have records, like homeless people as well.
Do you know of doctors within your professional community, colleagues, friends, who have turned people away?
So I think it's very important to be clear about this. Doctors, GPs, actually have no participation in registering patients. So when I work as a GP, for example, I don't personally register or deregister patients at all. My administrative staff do that.
Because the receptionist is the buffer.
Absolutely.
Right, okay.
Precisely. And in fact, the vast majority of GPs who I know, and indeed the Care Quality Commission, CQC, has highlighted this, actually go the extra mile often to make sure that they give the best possible care to these people who have come from very difficult circumstances, who have language barriers and so on, often getting interpreters involved, often spending far more than the 10 minutes were allocated per consultation. So I think GPs themselves, and indeed all healthcare professionals, and even receptionists, are trying their best. It is really an issue of a lack of clarity so far about the rules, and hopefully this new clarity and the new statement from NHS England will help overcome that.
Just briefly, there will be some people who say that GP surgeries are already full. You know, you only have to phone your doctor at 8 o'clock in the morning and hope that you might get an appointment at 5 a.m. a week on Tuesday. I mean, I'm being glib here, but it is hard to get an appointment as it is. So some people will be saying doctors are already oversubscribed. There should be perhaps other services for asylum seekers.
Well, I think the key way to solve that problem really is to give general practitioners and primary care the resources that they need to see their patients effectively. And this isn't just for asylum seekers, it's for the wider population as a whole. At the moment, we've got a situation where there is rising demand, huge financial pressures on practices, a massive exodus of GPs, and lots of practices are closing down simply because they don't have the funds to pay their staff and to see patients safely. So that is really the most important important issue in this. I think if we can resolve that, then receptionists will have time to clarify rules, for example, and GPs will have time to give these patients who have come from very difficult circumstances the care that they need.
Okay, Dr. Khan, thanks so much for your time. Thanks for coming in this afternoon.